In this video, I will explain the government's increasing involvement in public health since the 1900s. So, key point then. In 1900, the Conservative government had no plans to review the welfare provision. The 1906 Liberal government changed this attitude and introduced a series of reforms. So there was a change in government from Conservative to Liberal. From that time, governments have passed laws to improve public health with varying degrees of success. And the government now spends more on health, welfare and pensions than on any other sector such as education and defence. So laws have had a significant impact on public health. These laws saw the government have a more hands-on attitude in improving public health. And I'll go through some of the different laws that have been passed during this time period to help improve public health. So 1902 was the Midwives Act, and this regulated midwives. So midwives are nurses who specialise in the birth and care of babies, and it required them to have a certificate to prove that they were capable of giving such care. So in the long term, the Central Midwives Board was set up by an act, and it lasted until 1951. 1906, we see free school meals. So this provided a hot meal for some poor children, as it was the responsibility of local councils to choose whether to fund them or not. In the long term, the principle of giving poor children a free meal was made compulsory in 1914, and the school milk system began in 1934, and we still see that act being used today. 1907, medical inspections in schools. So in the short term, it had an immediate impact as it examined all children, but it did not treat the problems that they found. In the long term, school clinics were set up in 1912 to treat children. Medical inspections continued, and by the 1930s, most local councils had provision to treat minor ailments of children. 1908, this is where we see the old age pension. So in the short term, it saved many of the aged poor from the workhouse, so places where the poor went if they were homeless and penniless. And in the long term, the principle of providing help for the elderly still exists today. 1911, National Insurance. So this protected against unemployment and sickness by providing money to live on if people found themselves in no circumstances. Long term, the principle of helping working people still exists today. So these acts were like a foundation of our welfare system today, a lot of them. 1919, the Housing Act. In the short term, the Act promised 500,000 homes fit for heroes that we looked at in a previous video, but economic problems meant that less than half were actually built. In the long term, a series of housing acts over time led to slum clearances, council housing and government recognition that housing was a social responsibility that the government must be involved in. 1929, the Local Government Act. In the short term, the workhouse system ended, so people were no longer sent to workhouses. Local councils took responsibility for running local hospitals. In the long term, old workhouses became new hospitals, and these were eventually taken over by the National Health Service, so NHS, in 1948. 1940, immunisations. So there was a mass immunisation programme against diseases like diphtheria in 1940, and in 1948, tuberculosis, TB. In the long term, vaccinations became routine under the NHS. 1948, the NHS, a huge turning point, really significant moment in welfare in Britain for health. So the NHS, it provides free medical care for all UK citizens. In the long-term impacts, healthcare was no longer a luxury that only a few could afford, and we see a huge improvement in people's health because of directly linked to the fact that people now receive free healthcare. 1956, we see the Clean Air Act. So various measures were introduced to control air pollution. In the long term, it was the first of a series of laws which are designed to protect the environment. 1974, Health and Safety at Work Act. So regulations were put in place to ensure the health and safety of workers, and this is still in force today. So let's have a look at a good example of effective government action, and we'll look at smoking. So smoking then is a good example of effective government action. So in 1962, the link between smoking and cancer was finally accepted. So the government began to introduce measures to encourage people to stop smoking. By 1964, between 1964 and 2016, the government took steps to tackle smoking. These included banning cigarette advertisement, so that was 1964 to 86, promoting nicotine replacement products in 1998, banning smoking in public places, that took effect in 2007, and finally, in 2016, making all cigarette packaging blank. The government has started to tackle the problems. This leads me on to my next issue about obesity. So the government has started to tackle the problems of obesity, which is a major cause of heart disease. So we see campaigns to eat less and move more, and this is helping to combat this problem. Although the government has also been criticised as well for, first of all, acting too slowly. So acting too slowly in terms of smoking, probably because there was a loss of tax revenue from selling cigarettes and the loss of donations from tobacco companies. They did provide the government with a lot of funds from taxation. Also, some people accuse the government of interfering too much in people's lives and being like a nanny state. And some people think that you should still be free to buy what you want, even if it harms you, and that's your choice.